Okay, so another very important aspect we need to touch that is also kind of related to diabetes, although it's not diabetes itself, but is kind of related to diabetes, is the ketone bodies. Ketone bodies. Ketones. We can't talk about diabetes and not talk about ketones because they are related or they are interrelated. So, what are ketone bodies? Ketone bodies are water soluble molecules that are produced in excess during the breakdown of fatty acids by the liver. They are produced in excess during the breakdown of fatty acids by the liver. And the process that is involved in this breakdown of fatty acids results in ketogenesis. So ketogenesis is simply the formation of ketone bodies in the process of breakdown of fatty acid as alternative source of energy by the liver. Now, ketones themselves are not useless entities, so to speak, because normally ketones are produced in the body, even in somebody who is not ill, a normal, apparently healthy individual. You measure ketones in blood, you will find ketones because they have their own usefulness too. They are not useless, so to speak. But when they are produced in excess, then they begin to develop or because they begin to develop a problem and they cause their own challenges when they accumulate in the body. Now, ketones themselves are used as energy sources when glucose are not readily available. So it's not that they are bad altogether. Now, there are three main ketone bodies that are produced, which are acetoacetate, 3-beta hydroxybutyrate, and then cetone. Acetoacetate, 3-beta hydroxybutyrate, and acetone. These are the three major ketone bodies that are produced in the body. Now, acetone particularly is unique in its own way because it produces a fruity smell. So when an individual who has accumulated acetone, when you perceive the breathing or when you have opportunity of smelling the breath of that individual, it has a fruity smell. It has a fruity smell, and most times is one of the symptoms you find in diabetic patients. There's a particular smell when they speak or when they are talking or when they are breathing, and you are very close to them, you perceive it among them. And that is a diabetic individual who is tilting towards diabetic ketoacidosis. So that is that. Now, ketones are usually, there are two major conditions in which an individual can produce ketone in excess. The first one is in diabetes mellitus. Now, in diabetes, remember that there's accumulation of glucose, but the glucose are not being driven into the cell, and so they are not being broken down. The glucose are not being driven into the cell, so they are not being broken down, and so they accumulate in the blood. And so there's no availability of energy source. And so because the body senses that energy is needed, and yet glucose is not available for energy, the body now swings into alternative source of energy. The liver will now convert stored fatty acids, breaking them down as alternative source of energy so that ATP can be available to meet the body's normal need. So in that situation, there is excessive breakdown of stored lipids in the body of that individual. And so that is resulting in ketogenesis. There will now be excessive production of ketones that will eventually accumulate in the body. So in diabetes mellitus, ketone bodies are produced. Also, in starvation, an individual has not eaten or is on a fast or food is not available, or for one reason or the other, there's no availability of food. So the person is starved, glucose is not available. The body senses it that there's no availability of glucose, and so the gluconeogenesis sets in, where other alternative source of energy is required, particularly the breakdown of fatty acids to produce energy or to make energy available for the individual. In that process, there is ketogenesis, and so ketone bodies are generated. So these are the two major conditions that result in ketogenesis or availability of ketones in excess or accumulation of ketones in the body. Now, it's important to know that if a diabetic individual, the result eventually becomes or eventually is having ketoacidosis, is having ketones accumulate in the body. That condition is known as diabetic ketoacidosis. Diabetic ketoacidosis, and it is it's a very dangerous condition. When a diabetic patient swings into diabetic ketoacidosis, it's an emergency situation. In that situation, the glucose overload needs to be attacked immediately. The glucose needs to be brought down gradually by the physician, brought down gradually, because it is a very dangerous situation. Patients with diabetic ketoacidosis, most time, when it gets on to the point that it cannot be controlled, the patient can even swing into coma. So it's a very dangerous condition that is associated with diabetic individual. So in ketonuria, now ketonuria is ketone ketone bodies in urine. Now, in ketonuria that is associated with diabetes mellitus, you will find you find glucose in urine, you will find ketone in urine, and then there will be high blood glucose. But in ketonuria that is associated with starvation, you will not find glucose in the urine, you find ketones in urine, and then glucose level will be normal or low. That's the difference between ketones or ketonuria or ketone generation or ketosis that is associated with diabetes and ketosis that is associated with starvation. So it's important when an individual is having ketoacidosis to distinguish between whether it is ketoacidosis that is associated with starvation, ketoacidosis that is associated with diabetes mellitus. It is very important and is very vital.